Hello! Okay, I hope this is right. You should see my setup right now. It's a stable table on top of my bed with a box, and then my jewelry box, and then my phone balanced on a stuffed capybara, and behind it my ring light, which used to work as a tripod, but currently it's held together with packing tape and a paddle pop stick, and it's not supporting anything. My ring light is on the bed behind it on a 45-degree angle, plugged in over there. Hello, and welcome to 2023, my first video. The first video I'm posting. I already filmed another video, but it was very bad. Today, I wanted to talk about medical anxiety. I have probably mentioned medical anxiety before, but I wanted to go a bit more in depth, especially because often you don't realize how much of your life it encompasses. Recently, I've had a few things that have really brought up some severe anxiety surrounding doctors, and it is surprisingly not the things I think the most straightforward form of medical anxiety is I've had bad experiences with doctors in the past, so I am anxious to go to doctors now. I feel like that's a pretty straightforward one. Not to say that that doesn't make it serious, it very much is. Some people have this anxiety from specific acute events that have happened in the past. For example, if you had a surgery that went wrong, or one doctor who said something particularly bad, it can be an anxiety caused by that event. But the one that I have heard most often with my friends who also have chronic illnesses is just personally, my anxieties, while there are specific incidences sprinkled amongst it, it is the fact that I was undiagnosed from the age of 7 to 70. I had medical conditions that we first started investigating when I was 7, and I did not get a diagnosis until I was at least 17. Almost exactly 10 years of being undiagnosed. And you would be surprised the toll that it takes being told over and over again by doctors from the time you were a child, like through your entire adolescence basically, that, oh, what you are feeling is completely normal. And it doesn't seem like it would be very traumatic or cause much anxiety, does it? But it gave me this weird complex with doctors and with the world at large. When you are so young and you are told, basically like you're young, if you get lost in a crowd, you find a police officer. They're the people you trust, right? It's what your parents tell you. You are also told the same thing about doctors, nurses, teachers, like they're the people that you're supposed to trust, and if you are hurt or if you're in trouble, you go to them and they're going to help you. That's what a doctor is. You get sick, you go to a doctor, they help you. When I was 7, the main symptoms I was dealing with was just chronic pain, chronic, widespread pain, quite severe. And every single doctor I went to, GP, specialist, x-ray tech, or whatever, would tell me, oh, that's just normal. It's just growing pains. You'll grow out of it, it's fine. Turns out it wasn't normal, but how was I supposed to know that? I've only ever had one body. So you are left with basically two conclusions then. If you are feeling something and you're like, okay, my body is not okay, I am physically not okay, but then the people you are supposed to trust are telling you, no, it's fine, you're fine, you go one of two ways. You either don't trust yourself or you don't trust the doctors. Both end you in sticky situations of mistrust. For me, I went through phases of both, and frankly, I was in a position where I trusted neither. Because, well, I do not trust my body because it's giving me signals that do not make sense, and I didn't trust the doctors because they didn't understand what was going on, and they either weren't helping or the things they were recommending to help were actively harmful. So this creates my first anxiety about going to doctors. And that is, who do I trust? Who do I trust? Because there are some things genuinely that humans experience that are just quite normal. If you go to a doctor with a sinus infection and they say most sinus infections within adults clear up within 3 days, you don't need to worry. Okay. However, when I've been told 10 years previously that this pain I was feeling was normal, and then it turned out 10 years later that it was most definitely not normal and was quite a severe problem, how am I supposed to trust that that sinus infection is fine? you know? And then that also comes to the point of, well, okay, that sinus infection has gone on for too long, you need antibiotics. How do I trust that the doctor giving me this treatment is giving it to me with my best interests and with full understanding and education on this topic? Because yeah, antibiotics for a sinus infection is a fairly straightforward treatment. But when for many years I had treatments that always actively made the situation worse, how can I trust that even in a simple scenario, the treatment that I am provided is going to be appropriate or even helpful and not harmful? And this causes a lot of anxiety around going to doctors, because you go in going, they are going to tell me things and I do not know how to trust them. Because they might be telling you correct information, but when you have had such an experience of doctors telling you the wrong information and giving you the wrong treatments, how are you supposed to trust that they have your best interests in heart? My next anxiety has to do with mainly emergency medical situations. A lot of you might relate to this. When you have chronic illnesses that are particularly unheard of or particularly not well known, when you have a crisis emergency situation and say you have to call an ambulance or whatever, and you get into the ambulance and you're presenting with these symptoms, and maybe you can't communicate, maybe you can, but even if you can communicate, it's a stressful situation. Every single time I have had an ambulance respond to a medical emergency of mine, I have had to explain to them in detail every single one of my medical conditions. They have never ever even heard of any of them, which becomes quite stressful, because the underlying symptoms of some of those illnesses, whilst they might also impact the symptoms that I'm experiencing now in the medical emergency, sometimes they also mean that healthy vitals that medical emergency people are looking for are not healthy for me. For example, I have dysautonomia or POTS. I don't technically have POTS, but then again, the doctor I went to diagnose me with POTS didn't test me for POTS and then told me I definitely didn't have POTS. So I'm going to use postural orthostatic tachycardia syndrome just because it's a bit more straightforward, and also I have had multiple friends who have had this same experience. Having postural orthostatic tachycardia syndrome means that when I stand up or even just lying down, my heart rate healthily is a lot higher than what is normal for a lot of other people. So my heart rate generally rests at about 100, which isn't great, but it means I'm able to stand up without passing out. So what happened to me was I was at the emergency room, and the entire night my heart rate was between 100 and 120. And they were vaguely concerned about this, but not really. And I was like, it's a bit higher than normal, but I'm not super concerned about this. And then towards the end, just before I was discharged, my heart rate dropped to the very low 70s, which for me means I'm probably not safe to stand up. But all the nurses saw that and went, oh, this is great. You're getting better. You're all good. And by then I had been in the emergency room for over 6 hours. I was exhausted. I did not have the energy to explain that, no, that's not healthy. I have had friends who, after having procedures, have had nurses check their vitals and it's like, oh, your heart rate's 60, that's like pretty normal. And they're like, no, my heart rate needs to be a minimum of 80 for me to stand up and not pass out. And the nurses have physically picked them up and made them stand, and then they've had a seizure. Because the nurses had no knowledge of their underlying conditions, despite plenty of active work trying to explain it, and explaining it, them just not listening. So, in summary, it is a very scary thing to think, I am having a medical emergency. I might be having a stroke. That was my most recent one. I might be having a stroke. And then the ambulance arrives and you are sitting there trying to explain what myalgic encephalomyelitis is, what dysautonomia is, what hypermobility spectrum disorder is, what all these things are. What? Because if I don't explain them, there is a high likelihood that they could give me treatments that are detrimental to my health. Hello, Editing Acacia here. This is not to say that I expect every paramedic to have an understanding of every medical condition there is. I understand that's impossible and quite a ridiculous
expectation. I'm basically just saying that because they can't have a knowledge of all my things, it adds to the anxiety of those situations.
Now, my third one is, unlike the previous ones where the problem was doctors giving treatments that are not healthy for you, this one is doctors refusing to give any treatments. So for 10 years, I was completely undiagnosed. So all the treatments I received were either exercise, which we later found out was bad for me, and that was it. And it got to a point where I was going to pain specialists at hospitals, and the pain specialist said, yes, I am going to recommend this specific drug for you. However, I want your GP to prescribe it because then they can prescribe you repeats and you don't have to wait 6 months and spend $500 every time you need a repeat of this medication. And so I took all that, I took the notes from the appointment, I took everything to my GP, and my GP looked at it and said, I'm not going to prescribe you that. And I was like, why? And he's like, well, you're a young girl and you have worries. Now, I understand in hindsight that what he was trying to say is, you have anxiety and depression. I am concerned that this medication could be abused. Maybe say that, because then we can work on a plan to look out for the warning signs of if I was going to abuse medication or something. No, instead he just said, you have worries. So I never got given that medication. Another example is I caught viral vertigo when I was 13, 14. And it was really bad. I was missing a very large amount of school. I was at school maybe 2.5 days a week, and generally I would go to school in the morning every day, even though I felt horrible, and have to go to sickbay halfway through the day and get taken home. It was horrible. I was barely eating. I couldn't keep food down. I was missing more than 50% of grade 9. Assignments weren't getting handed in. It was a severe problem. I was not socializing. I was eating almost exclusively potato chips and frozen raspberries because they were the only things that wouldn't make me feel more ill. And we went to doctors for this for ages and they never said anything. So we thought, oh, it's just one of those things you have to get through. The thing that was always said is viral vertigo, it comes and goes. So you just kind of have to wait for it to go and hope it doesn't come back. And lo and behold, my vertigo did come back again. This was about a year ago, so about 5 years after my first really severe episodes, came back severe again. And about 6 months before this, my fiance had had his eardrum burst. And one of the things they did for it was they're like, it doesn't need surgery, but we're going to give you this medication which helps with the vertigo caused by having a burst eardrum. This was the first I'd heard of any medications which prevent dizziness. So I went to my doctor and I discussed it and nothing happened. So I asked specifically for medication and they said, oh, we can try putting you on this one. And they gave me something else, a low dose that didn't work for me. And then when I went back, I was like, look, my fiance has this medication that he takes when he gets dizzy from his burst eardrum and it stops his vertigo attacks. And she was like, oh, yeah, we can give that to you. And I'm like, thanks. So I took it home, I tried it. It works. It works wonderful. It takes me from being bedbound 4 out of the 7 days of the week to actually being able to go in cars, go on buses, catch trains, eat food properly. It's wonderful. But my question is, why was medication never even suggested when I was disabled purely because of my vertigo? My vertigo was so severe that I was incapacitated. Never mentioned. Now, maybe it was because I was younger at the time. That would make sense. But the fact that it was never mentioned, not even once, when it was quite actively ruining my life, that's fun. And then when I went back again, it again was not mentioned until I actively brought the doctor here is the name of the medication. Can I try this? And they said, oh yeah, you can try that. It's not really a problem, not really any side effects that you really need to be worried about. Go ahead. Why was it my job? Why was it my job to do all of that research for a medication? I am on 3 medications. I'm on an antidepressant, I am on a pain medication, which I take as needed, and a dizzy medication, which I take as needed. However, it then creates this weird paradigm because I do not take my medication as I need it. For example, I'm supposed to take it when the pain gets bad, or if I'm expecting it to get bad, or when the dizziness gets bad, or if I'm expecting it to get bad. For example, I take it before I got on a bus, so I didn't throw up on the bus. I do not take it because I am terrified that my symptoms will all get worse and doctors will never give that medication to me again. That I will have found something that helps, and weirdly enough, when you find something that helps, it kind of makes you realize how bad the symptom was in the first place. Specifically with my vertigo medication, I do not take it because I am terrified that my doctor will not prescribe it to me again. Because doctors have done that to me before. Like that GP who had advice from a specialist and he was like, yeah, I don't really know anything about it. Even though this specialist in the field, who's like the best in the city, has recommended it for you, just don't think I'm going to give it to you. So I stopped taking my medications because I am terrified that I am never going to get help for my conditions again. And then there's the anxiety of, I guess this almost falls into a social anxiety, is that every single interaction I have with my doctors, primarily my GP because they're my main care provider, I am on the edge of my seat. I am reliant on that doctor to give me the medication I need to function. I'm reliant on that doctor to give me referrals to any specialists when more complicated things arise. I am reliant on that doctor to manage my daily health, like sending me for blood tests and all that. I am reliant on that doctor to fill in the paperwork for my disability pension, which means I can pay rent. Whilst there is always a power dynamic with medical professionals, when you are disabled and chronically ill, that power dynamic becomes greater. Because if I say something and my doctor interprets that as, oh, she means this, they don't fully understand me, or they think, oh, she's just faking it, or oh, I mean, she could probably work if she tried. It means I could lose the doctor doing the paperwork for my disability pension, meaning I do not have an income, meaning I can't pay rent. It means I can lose the medication that allows me to function to the small degree I already am. It means the doctor could stop taking me seriously when I mention serious things. It puts you in this situation where you feel entirely beholden to this doctor, in that they have almost absolute power over your life. They have the ability to take away my income. They have the ability to take away medications that allow me to function. They have the ability to take away the ability to get testing into my health done. It becomes this high stakes appointment of making sure you express your needs clearly enough, but not to a point where they think that you are trying to get a specific drug or trying to get a specific treatment. Because for some reason, that means you're an addict or you're a hypochondriac, which doesn't make a lot of sense. I am here providing you with the documents and the research that, oh, this treatment would be beneficial to me. But for some reason, this reminds me of that scene in My Big Fat Greek Wedding, where she is trying to bring up an idea to the father of the family. And she says, we have to make him think it's his idea or he won't do it. That's kind of what it's like with doctors. I have to make it seem like they came up with the idea or they won't give it to me because they won't do research into my condition. Because I've done the research into my condition. I subscribe to magazines that follow recent developments in medical treatments of the illnesses I have. I'm the one who listens to the anecdotal evidence. I am the one who researches all the specific strings. And I go, okay, well, the best treatment for me would be, for example, IV saline. I'm just using that as an example. But if I go to the doctor and say, hi, I think IV saline would help, they'd be like, I don't know. How do you know? You're just making it up. You are, because how would you know that? So you go in with your research, but you have to be like, I don't know, whatever you think. I think this video has been a bit unhinged. I'm very stressed about a lot of these things at the moment. I'm hoping this is good enough to post because I have filmed multiple videos this year which I have not posted because I did not think they were good enough. So I hope this video wasn't as unhinged as it seems right now to me. But I want you to share with me your anxieties about doctors because they can present in very weird ways. And sometimes they can seem completely irrational, like my thing of not taking medications in case I need them more later and I'm not able to get more. So let me know. I'd love to hear. I'd love to hear that I'm not insane. Because right now I feel like a lot of these things, as I speak them out loud, sound completely ridiculous and irrational. How about you? How does your medical trauma make you anxious? I hope you're excited for 2023. I am planning to post at least once a month this year. As you can probably see if you look back at my previous upload schedule, I get too enthusiastic and I will film and edit 3 videos in a week. And then I'll be so exhausted I won't be able to make a video for several months. Which means I will have, say, 2 videos in a week and then none for 6 months. This year, I have given myself a rule, and that is I can only post once a month, and I can only do a video once a month until I have 12 videos. And then if I have a surplus of 12 videos, I can then start posting more than once a month. But I'm pacing myself. I'm gonna do this. I'll see you next time. Bye! I can't fix my nail because the glue is in the box underneath my jewelry box. Oh wait, no, I didn't put it away.